Should I stay on my group health coverage or go on Medicare? What's up, friends? This is Rob. Some know me as the Medicare Minister with Agape Insurance and Financial Group in Tupelo, Mississippi. And this is a question that we get asked all the time here at Agape. Is it better for me to go on group health coverage or stay on group health coverage, I should say, or go on Medicare? And so today what I want to do is take a little bit of time to break down some things that you want to consider if this is a question that you're pondering and asking yourself. So number one is we need to consider, what is the premium? What is my current coverage at my work costing me? What is the deductible? What is the co-insurance? What is the max out of pocket, which just simply means what's the most that I'm responsible for in one calendar year on this particular group plan? And what co-payments are involved when I go see the doctor, when I go see a specialist? What about for my generic and brand name medications that I'm taking? And so these are all things that you want to consider, whether you're going to stay on group coverage or go on Medicare. So what I've done here on the screen is I put some of the Medicare costs there in front of you, because if you don't know the answer to that for your group coverage, you definitely want to go get all of that so you can compare apples to apples and oranges to oranges with Medicare. So a couple of things that we need to be aware of when it comes to Medicare. Our Part A premium for most people is going to be zero. That's our hospital insurance. It's not going to cost us anything at all. However, every so often, it's very, very rare, there could be a cost involved. More than likely, if you're watching this video, you're going to be in that 90 to 95% bracket of no cost for your Part A premium. Part A does have a deductible involved at $1,600. But once again, if you get on what's known as a Medicare supplement, like a Plan G or a Plan N, or the fancier term is a Medigap plan, then that deductible, you do not have to worry about that. And I'll talk a little bit more about that in just a few minutes, okay? Part B, where Part A doesn't have a charge, Part B for most people is going to be $164.90. Now you see here on the screen, it says high earners may pay more. And so there is a bracket of income that you have to be in to stay in that $164.90. Once again, most people that we work with are in that bracket of $164.90. However, if you and your spouse, or just you by yourself, is making an extremely high six-figure income, then we definitely need to take a look at that for you. And you're more than welcome to call us. The number should be on the screen or down in the video description. And either myself or one of our seasoned advisors would be more than happy to help you. The other thing that we have to consider is a $226 deductible. That's annually. That is the Part B deductible for 2023. So where you could get a Medigap plan to cover that for you, if you qualify for Medicare on January the 1st, 2020, going forward, there is no longer a supplement that covers this little Part B deductible. So let me kind of quickly recap. Part A is not going to cost you anything, but it has a deductible in place of $1,600. However, there is a Medigap or Medicare supplement that I can get to shield me against that. Part B has a $164.90 premium. That's where most people are going to fall into that bracket, and it has a $226 deductible for the year. That's for this year. That's the 2023 deductible. Okay. And there is no supplement that will shield you against that if you qualify for Medicare on January the 1st, 2020 going forward. So I want to be very clear about that so you can understand what it is that you need to compare, whether you stay on group or go on Medicare. Now, let me stop real quickly right here and just say, if you're getting value out of this video, please take a moment to like, place a comment down if you have any additional questions, or let us know that this provided value to you. Subscribe to the channel, turn on the notifications. That way you're notified every time we drop fresh content like this. And feel free to share this with someone who's maybe asking themselves the same question and is in the same dilemma. All right, so What do I need to consider when whether I'm going to stay on my group or whether I'm going to go on Medicare? Once again, these are some of the top factors here. I've broken down some of the Medicare costs for you. The other thing you have to decide is, which direction am I going to go on Medicare? Am I going to go on a Medicare supplement, also known as a Medigap plan? Or am I going to go on a Medicare Advantage, also known as a Part C plan? So let's start with original Medicare and a supplement or Medigap plan. The two most popular plans are the Plan G or Plan N, because if you remember, I just said about a minute or two ago, if you qualified for Medicare on January 1st, 2020 going forward, you can no longer get what's called the Plan F. That's what I call the Cadillac plan. Okay, so these are the two most popular plans you see here on the screen. So not only do I got to factor in the cost of my monthly premium for my Plan G or my Plan N, but now I have to factor in the cost of what is my drug plan. What is my Medicare Part D going to cost me to help me take care of my prescriptions? And then there's also a deductible associated with my Part D plan, and that is $505 for the year for 2023. Now, the good news is this never comes into play if I'm only on tier 1 through tier 2 drugs for most plans. Okay, so I don't have to worry about that deductible if I'm on very common maintenance drug medicines like lisinopril for blood pressure, or some type of statin for cholesterol, or if I'm diabetic, if I'm on metformin. Those are all lower tier drugs, and that deductible never comes into play. The other thing I need to consider is Medicare does not cover dental, vision, or hearing. So if I have some of those needs that I have currently, if I'm going or thinking about going on to Medicare, or a lot of times these needs arise as people have been on Medicare for a few years. So the chances or probability of you needing this extra plan is pretty high. So you got to factor in that cost as well. And then any additional ancillary plans that you may need, like a cancer plan or life insurance or heart attack and stroke. Those are all things that you need to be aware of when it comes to going on Medicare, because Medicare does not cover those things. All right. So the other option that you need to consider if you're going on Medicare, or whether I stay on group coverage, is the Medicare Advantage plan or Part C plan. Most of these plans are zero premium plan to low premium plans. And what they simply do is they take your medical, your prescription drugs, some dental, vision, hearing, chiropractic, gym membership, over-the-counter benefit for over-the-counter items, and more, and they put it into one zero premium or to low premium plan. So this could be a very viable option if you're coming off of group coverage, and you may want to consider going this route to save the most amount of money. However, you do need to be aware that there are max out-of-pockets involved, like your current group plan. There are co-pays built in throughout the whole program, so you need to be aware of that as well. But many times we have people that we work with get what's called a hospital indemnity plan, or I like to keep it simple, a GAP plan, to help shield against some of that max out-of-pocket and co-pays that are built into the plan. So once again, if you just get the Medicare Advantage plan by itself, more than likely it's going to cost you nothing with all of those benefits into one plan. I do not recommend that without getting what's called a hospital indemnity plan or GAP plan to help shield you against that. Okay, so and generally those depend, where you live and other factors on what the monthly premium would be. But that's something that you have to factor in when it comes to comparing your group coverage versus going on Medicare. The last thing I will say is this, is that once you sit down, and once again, we're more than welcome to help you, or we're more than happy, I should say, to help you review this, compare apples to apples, oranges to oranges. We don't charge anything for this. You're not under any obligation. The number should be on the screen, but if it's not, it is down in the video description. Reach out to us and we would be more than happy to review this for you. But If you're going to stay on group coverage, I've highlighted it here at the bottom, then you'll need to decline your Medicare Part B, because if you don't, it's not going to help you in any way, shape, or form. And plus, you're going to pay $164.90 for nothing. So it's better for you to decline your Part B if you're going to stay on group coverage. Well, I pray that this video has provided you some value. Once again, please like, comment, subscribe below, turn on the notifications so that way you are notified every time we drop fresh content like this. God bless you guys, and we'll see you on the next video.